But even if you are over 65 or you're trying to get an appointment for someone who is, we know that the process has been very difficult. And so does a Pitt professor whose research focuses on the healthcare system for older people. Dr. Stephen Albert is chair of the Department of Behavioral and Community Health Sciences at the Pitt Grad School of Public Health. Dr. Albert, thank you for making some time for us tonight.
Thank you, Megan. Pleasure to be here.
What vulnerable populations do you feel should be getting attention right now but aren't?
Okay, well, phase 1A in the current state plan includes healthcare workers with actively facing patient care, as well as older people in long-term care facilities and people over age 75. That seems perfectly reasonable. The next phase is to bring that age down and to capture people with more chronic conditions. I think given the emphasis on schooling, probably teachers will be included in that. And all of these are key populations. The one that I think might be falling through the cracks are older people in their homes with disability who are not in long-term care facilities. These folks are likely to be as impaired as people in nursing homes, are known to healthcare systems, and could presumably be reached through those systems, but it's been difficult so far to get to them.
Is there a national plan for getting vaccines delivered to any homebound adults right now?
Well, it's through the health departments and hospital systems. For example, in the Area Agency on Aging, which supervises and arranges services for older people, forwarded the list of those names and those agencies to the health department. And now I think the effort is going to be to work with those agencies to get vaccine to those people. Sometimes it might be simply arranging transportation for those folks to clinics or mass vaccination sites. And in some cases, it may be combining a vaccine visit with other kinds of home services that are brought into people's homes.
Do you know how many people we're talking? How many live in nursing homes or those long-term care facilities that are vaccinated or in the process versus homebound adults?
Right, good question. You know, about 3% of people over age 65 are in residential long-term care, but probably as many are in their own homes in the community with equal levels of disability. So another 2 or 3%. There's about 2.5 million alone who are getting home care services delivered to their homes through our Medicaid waiver programs. And states have additional programs. So if you added that on, you're probably talking about a couple of more million across the country. So it's not a small population.
What risks do we run into as a community if we do not make active attempts to vaccinate homebound seniors or the disabled?
Well, you know, older people are at very high risk of severe COVID mortality and morbidity. They do, even if they're in their homes, we say they bound. It's not really accurate. These people do leave their homes periodically and with help should be able to get outside once in a while. They do have people coming into the homes. So another key thing would be to make sure the home care providers are also vaccinated. And I think outreach is going on for that group as well. They're a little more dispersed than people we see in long-term care residences. So it's a little harder challenge.
And that was going to lead to my last question. When you say outreach, who's talking about this issue? Who's trying to develop ways to fix it?
That's also a very good question. Yeah, you know, at this point, the home care agencies and the people who bring services into these homes are, you know, they have people going to their homes or are doing telemedicine checkups with folks. I think they're the ones who should be making clear the benefits of vaccination and giving people realistic expectations on how to get vaccine. But unfortunately, a lot of it depends on the initiative of an older person and their families to do this right now and find vaccination.
Dr. Stephen Albert is the chair of the Department of Behavioral and Community Health Sciences at the Pitt Grad School of Public Health. Dr. Albert, thank you for making some time for us tonight.
My pleasure. Thank you, Megan.